Hi, I'm Rochelle Carey in for Femioki, and you're in the stream. In the first year of the coronavirus pandemic, parents took comfort that children appeared to be at low risk of illness and death from COVID-19. But now there are concerns that 74 million unvaccinated Americans under the age of 12 may be more likely to fall sick from the more infectious Delta variant. So today we're going to look at how children are now being affected by COVID-19. Share your thoughts, questions, maybe concerns right in our YouTube chat. We'll be monitoring those comments, and I'll bring those questions and comments to our panel today. We're going to start today hearing from Ann Sosen. She's a policy fellow at Dartmouth College and also a parent.
We've asked our kids to make a lot of sacrifices during the pandemic. Now we need to ask our policymakers to put their health and education first as schools reopen. It's essential that policymakers take rapid action to curb soaring transmission across our communities. At the same time, we need them to implement strong guidance that includes universal masking in all K-12 settings.
So to help us work our way through parts of this conversation today, I'm joined by Dr. Lucy McBride. She is an internist. Dr. Adam Ratner is chief of the Division of Pediatric Infectious Diseases at NYU at Langone Health, and with us from Florida, a state that is seeing a high rate of children in the hospital. Dr. Wasim Rahman, thank you all for joining me. And actually, I'm going to start in Florida with you, Dr. Rahman. As a peds doctor, what is it that you are seeing right now?
We're seeing a large number of patients with COVID now. It's in the last couple of weeks, the numbers have just soared, which is unusual because a year ago we didn't see that many cases in the emergency department or in the area.
So when the parents come in with their children, what is it that how the children presenting? What is it that the parents are saying that they're seeing?
Typical what you'd see in many respiratory or even gastrointestinal viruses. We're seeing a lot of respiratory symptoms, runny nose, cough, fever is definitely one of the symptoms that parents are concerned about. Also vomiting and diarrhea. And occasionally we'll see a rash or so, but any combination of that is what we're seeing.
So a lot of those things that you just said can also be something else in kids. Kids get sick, right? So are you seeing that there are kids that are coming in that the parents are assuming right away it's COVID when it may not be COVID?
Oh, absolutely. As a matter of fact, what's interesting is respiratory syncytial virus, also known as RSV, is typically seen here in Florida, somewhere starting late, maybe October. We didn't see much of it all year because of, kids, more of the social distancing and the masking. And then about the third or fourth week of March, we saw a complete upsurge of all the other viruses. And COVID is mixed into that. So we were seeing already the viruses that we didn't see. We literally have not seen any flu. And then now add the Delta variant as of 3-4 weeks ago. And, you could just see the fear, it's what we saw happen in adults mostly in the last year and a half.
So, Dr. Ratner, is the Delta variant more contagious among kids?
I think there's pretty good evidence that the Delta variant is more contagious among all of us, adults and children. And that's part of the reason that we're seeing such high case numbers now. The increase in cases in kids isn't because the Delta variant is necessarily more virulent for children, but it's just that there's so much COVID circulating in the community that we're seeing more cases in kids. And also that many of the adults, especially the older adults, are vaccinated now. Even in states where the vaccination levels are relatively low compared to other states, many of the folks over 65 or 70 have been vaccinated already. And so this, as many people have said, is a pandemic of the unvaccinated now, and the unvaccinated are a large part of that is children.
I want to put a question, and I'm coming to you, Dr. McBride, but I want to put a question to Dr. Rahman that we just got on YouTube. Specifically, the question from Aphrodite, I hope I'm saying that right, is what is the recuperation rate in children? Are some children more vulnerable than others, and why?
I'm seeing it in all age groups. I think the children who are getting sicker tend to be kids with some risk factors. These are kids who have immune problems, are on chemotherapy, diabetes is another, and also any morbid obesity is another one. We're seeing some children more likely to be affected. Most children will recover fine. Um, it's just a virus, and it'll with supportive care will do fine.
Dr. McBride, I see you nodding to that. I think that might be reassuring to some parents to hear that.
Sure. I mean, as we all, I think, agree, this is an extraordinarily stressful time for parents, for families, for anyone, really. Anybody who's watching the news, anyone who's paying attention to the surging Delta variant in our country. It's affecting us all emotionally, if not physically. I'm seeing patients who, from age 16 to 96, and my parent patients are particularly worried because they see what's happening to children. And indeed, as Dr. Ratner just explained, the Delta variant is highly contagious. Therefore, it's infecting more unvaccinated, unimmune people. But it's not thought so far to be targeting kids in particular. The thing I'm telling parents when they're particularly worried is to remember the facts that most kids, if infected with coronavirus, even with Delta, will have either no symptoms or mild symptoms. But that can be cold comfort, right? I mean, kids are vulnerable because they're unvaccinated. And the way to protect kids is by vaccinating adults in their orbit and in their midst and getting everyone dose 1 and then dose 2 of these extraordinarily effective vaccines.
And we will come back to talking about the vaccines as well. But you specifically wrote a piece for The Atlantic, Dr. McBride, titled "Fear of COVID in Kids is Getting Ahead of the Data," which is, you already acknowledge that's not necessarily going to make any parent feel better. But what it seems that it is important to get the right information to them, to let them be aware, but not to overhype it. And I think that puts a lot of responsibility on us journalists to try to do that properly.
Yeah, it's so difficult, right? Because, the tragedies among young people abound. And it's extraordinarily tragic how kids have been the victims of adults' inaction, frankly. And they are the victims of large swaths of the population not being immune to coronavirus. It really breaks my heart. At the same time, and this is an and, not a but, we can take some comfort, again, depending on where we live, depending on our child's underlying conditions, depending on our household and how immune competent we are in our households, that generally most kids experience a common cold or no symptoms at all. But again, this is why hopefully I will always have a job, and why the two fine physicians on this panel will always be employed, is because we recommend particular advice to the particular family, the particular patient in front of us, and that's very nuanced. It's hard to message relative risk, and I do agree that your jobs are particularly difficult right now.
We have some comments from a parent. Her name is Allison Goldberg, who really, I think, crystallizes some of the frustration that parents are feeling. And you referenced this, Dr. McBride. Let's go ahead and listen to Allison.
I know that there are others out here like me who are just devastated and outraged that we are dealing with such a desperate situation where we are faced with an emergency crisis and an education crisis that didn't have to happen. If only our leaders would have made the right decision to really take the health and safety of our kids seriously, and move back into hybrid formats and allowed for kids like my daughters, who both have a medical condition and also a learning disadvantage, to continue to receive the equitable education that they deserve and that they must have and that they need.
Dr. Mann, what would you say to a parent like her who is trying to do the best for her kids? Obviously, kids being in school is good for their mental health. There's any number of reasons that kids need to be in school, but say you do have children that are immunocompromised, and then you're in a state like Florida that the governor won't let you mandate masks. I'm not trying to pull you into politics, but this issue has been politicized. What would you say to parents like her? You could tell how much pain she's in trying to figure out what to do.
Yeah, absolutely. Because some of the families that I see, they say we're doing everything right, but once the kids go to school, it's out of their control. We've always pushed for people to get vaccinated, the masking, hand washing, just general common sense things. And, ultimately herd immunity will come into play, but after it takes its toll, those are the only things we have at this point to fight the virus. But, the things that's maybe reassuring is that, most of the time it's a mild illness. And the fact that, you can do the best you can. Again, I'm not a politician, and, it's always been a challenge, but the virus doesn't care who you are, where you live, and what you do. We're the host, and it's going to take its toll on us.
I want to reference a few of the headlines and stories that we've seen, because, the issue now is that kids are going back to school. They just started in some places a week or two ago, and there's going to be more, rolling schools opening. So, there's an article in particular that says here, schools can't open safely. An epidemiologist describes what works and what is not worth the effort. I'm assuming you would all say that something like masks work. But already there are kids that are in quarantine, thousands of kids that are in quarantine as schools have reopened. Dr. Ratner, is that something that you expected to see?
So I want to go back to what we heard a few minutes ago, which is that this is an emergency, and what we do to keep children in school now is critically important. I think that everyone on this panel, and I imagine all of your viewers, agree that kids belong in school, and if we can do in-person education safely, that is something that we as a society should be prioritizing. And the way that you do that is you vaccinate anyone who can possibly be vaccinated, meaning that every teacher in the school should be vaccinated, everyone who's not a teacher in the school should be vaccinated, and every kid who's eligible should be vaccinated. And we should be pushing for the younger ages to be opened up for vaccination as soon as we can. And just to say one more thing.
Sure.
There are other mitigation measures that we use in schools, masking, distancing, limiting of high-risk extracurriculars. There's a whole slew of things. And what we learned over the course of the pandemic, and this was hard-won knowledge, is that those things work, even if people aren't vaccinated. And so you layer these strategies. You vaccinate everyone you can, but you also do the masks and the everything else, even though it is painful at this point. But that is how you keep kids safe. That is how you keep kids in school, and you keep the schools open. And it's an emergency, and we have to all work together to do this.
A headline on an article that you wrote for the Daily News is very clearly says, vaccinate kids against COVID now. So, Dr. Ratner, explain what's taken so long. I know you don't work for the FDA, but explain what's taken so long to get to the phase where it's approved for kids to get vaccinated.
Sure. It's a balance. All of these things. Look, what we all want is to be able to give these vaccines and make sure that we're doing it safely. And so with every decision we make about medicines for children, we're balancing what we know about safety and what we know about efficacy. And, what the data that we have from adults and from the older group of children that's been vaccinated is that these vaccines are extremely safe and they work very well. There's concern about the need for booster shots now, but even in the setting of that, you have incredible protection against hospitalization and severe disease. There have been a couple of side effects that have been found that we did not see in the early trials that have been seen as we've rolled vaccines out to more people, and those are being followed up. That's an example of the system working, not the system not working. And everyone who has reviewed these data, the FDA, the CDC groups, the American Academy of Pediatrics, is in agreement that the data suggest that that the vaccines are safe and that they are much safer than not being vaccinated, especially now, especially in the setting of Delta virus circulating. So what we need to do is expand vaccine eligibility down to the 5 to 11-year-old group. We probably have the data to do that now. FDA and CDC have indicated that they're going to be waiting for at least mid-late fall for the first round of data from the 5 to 11-year-old trials. I would argue that, as we've said, this is an emergency, and based on the pediatric data we have now and the literally more than 1 billion doses of mRNA vaccines worldwide, that we could EUA these vaccines at this point.
Dr.
I agree, Dr. Ratner. This is an emergency, and as you just said, and we talked on the phone earlier today, that getting kids in school should be a national priority. They need school not only for their, learning, but also for their social and emotional health, for their safety. Many kids are fed at school, and that's one of the only places they get fed. It's the only place they feel safe. So absolutely, it should be a national priority. The other, there's a lot of national priorities right now, but one of them should also be getting unvaccinated adults their first dose. So as you know, when you have been vaccinated, you're not only less likely to get COVID-19, you're less likely to transmit the virus. Now, has that waned? I'm not going to say waned. Has that diminished a little bit because of the Delta variant? Yes, but it doesn't mean that vaccinated people are as likely as unvaccinated people to transmit. When you have had 2 doses of one of these mRNA vaccines or a single J&J shot, even if you get infected with coronavirus, you're less likely to get, you're very unlikely to die or end up in the hospital, but you're also very unlikely to shed virus asymptomatically such that you can infect other people, namely unvaccinated kids. One of the things I come across regularly in my adult patients is vaccine skepticism, not anti-vax so much, but skepticism about its ability to reduce transmission to other people. And it's often when I explain how, maybe you're not worried about yourself, maybe you're not worried about getting COVID yourself, but when you understand that getting vaccinated yourself protects our most vulnerable populations, right, and protects kids, then people are often swayed, because I think one of the main problems here is not getting adults their first shot.
Okay, so
and that's of course what I spend a lot of time on.
I agree. So let me put this to you. We did see vaccinations drop after there was this initial rush to try to get people vaccinated. How skeptical do you think some parents might be to get their kids vaccinated once it's officially out there and there's the push for it? Dr. Rahman, how do you think parents are going to deal with it?
Well, I'll be honest with you, I ask a lot of the families, are they vaccinated? And there's a lot of skepticism. After the child turns positive, then it's a little different story. They just realize that they are responsible right now for that child getting infected. There's a lot of skepticism, and typically what you'll hear is, I read that, and then da-da-da-da-da. That's what you hear a lot all the time. And I just one thing on masks. I have seen more 2-year-olds keep a mask on than I've seen adults keep masks on. So they're really good about it.
Sad but true.
And I really want to stress that, because it's almost, if you make it fun, they'll do it. And I think school started last week here. So I expect to see a lot more kids or concerns or more COVID in the coming week or two. And just to add, I know there's a lot of stuff we can talk about, but I'm a little concerned, and Dr. Ratner can chime in, of the inflammatory disease. Now that more kids are infected, time will tell if we're going to see more kids with the inflammatory, the rare complication of the inflammatory disease. So something to keep in mind.
Just to comment on that briefly,
Sure.
I think that you're right. I mean, so there's this multi-system inflammatory disease in children that can happen rarely after COVID infection. There is also the potential for complications like long COVID. And the way that we deal with this is we keep children from getting COVID in the first place. And so that goes back to everyone around them being vaccinated, and vaccinating kids as soon as we can, and masking and all of the other things. But you're right. I think that the increase in pediatric hospitalizations, the increase in pediatric deaths that we're seeing now isn't necessarily a more virulent virus. It's that we're seeing so many more pediatric infections now. And along with that increase in pediatric infections, we're going to see more of these rare complications. So I think that you're right. I think we should prepare for an increase in cases of that inflammatory syndrome in the coming weeks.
Okay, so since we do have an international audience, I definitely want to try to broaden this out just a little bit. And I want to play some comments from a doctor in India, Dr. Navin Thacker, talking about how the Delta variant has played out there, particularly with children. Let's listen to that.
India is just coming out of a very explosive second wave of COVID-19 due to Delta variant. Our recent zero prevalence studies show children were equally infected as adults in this wave due to Delta variant in comparison to first wave, which was due to other variant and affected very few children. We must remember when large number of children are affected, it does increase hospitalization, but still most of children had asymptomatic or mild infection even with the Delta variant.
So we really are all in this together. I think that this pandemic has really driven that point home. And we have a comment from Arnav Arora on YouTube that says India has been vastly incapable of providing vaccinations to its citizens, and the country is now moving back to the norm without many precautions. What are your thoughts on developing nations? This is someone who sounds very, very concerned. I mean, Dr. McBride, just talk about how important it is that it's not okay if one country is doing better and another country isn't. We all need to get better at this.
That's right. This is a global pandemic. And one of the things that I was distressed about yesterday was the talk about giving people third doses in a blanket statement about all Americans needing a booster shot after 8 months. When if you most of the scientists, epidemiologists, and public health experts that I trust at least, and based on the data I'm looking at, the science doesn't support a third dose for every American. But at the same time, we want to boost the immune protection of those of us in our communities in the United States who are at highest risk, people who are immunocompromised, people who've had solid organ transplants, people who are elderly and have underlying health conditions. Absolutely, they deserve to have that extra protection. What I'd love to see is more people in the United States have dose one, really work on outreach and meeting people where they are to get adults and those eligible for the vaccine dose one, and then giving our global allies doses, because the more that we give overseas, the less we continue to see this virus run roughshod through the globe. It's not only the right thing to do; it helps us to vaccinate our global allies and to reduce the chance of further variants that can potentially escape immune protection from the vaccines, which of course hasn't happened yet.
Dr. Rahman, we're almost out of time, but I want to put the final question to you. And I've got a note from the producers that are monitoring YouTube that says that we still have so many comments from people that are skeptical that COVID is real. I mean, when people come in with their sick children, are you still dealing with people, Dr. Rahman, who still just seem to not be living in reality?
Oh yeah, we do see it. We get challenged on the reality of it, but it's not as common. But there are definitely people, the folks that don't believe in vaccinations, and in general, are going to say that. I can tell you that in my practice over the years, that normally I'd see one or two people that are not vaccinated, kids a year that are not vaccinated. Now it's literally every shift. So there's definitely been maybe a global shift in that direction of not vaccinating, and this just fuels the misconceptions that we see with the COVID vaccine. But once they start to see it and their child is sick, I think it may be just too late at that point.
Wow.
But I have to, and I think
I'm gonna have to.
The problem is
I'm gonna have to wrap. I'm gonna have to wrap there, Dr. Rahman. My apologies for putting you in that position, but thank you all for your time, your expertise and the work that you're doing in this time. We really appreciate it.
Thank you.
And thank you all for joining me here in the stream. We'll continue to take a look at your comments here on YouTube. My name is Rochelle Carey. Thanks for spending time with me this week. That's all for now.